Wonderful, thank you. So Carolyn, what excites you the most about Trappsol Cyclo and the Transport NPC study? So if the study is positive and if approved, what do you think the impact will be to how the disease is treated, and would you use it in your practice?
Thank you. Well, a lot excites me, so it's hard to answer that question. But I'm very excited that this idea, which initiated in a discovery in a mouse lab in 2007 by Dr. Beniou at UT Southwestern and then translated to my patients the following year, is now coming to fruition, and it will positively impact patients globally with NPC. It's been a long road, sometimes bumpy, but I'm confident that we have an excellent team that has worked to optimize very carefully the methods of drug development, administration, and dosing, as well as the precise clinical assessment so that we can accurately measure outcomes. And this is very important. I mean, we've learned from those ahead of us in many ways as well, but we've also been very diligent in developing this study. So many patients have had benefit from being on this treatment and have continued drug dosing post our earlier trials or compassionate use. And so we know that there is a positive impact on the clinical signs and symptoms and that it's impacting quality of life as well. So I'm confident that on the other end of that many more patients will be able to have this experience. So I'm hopeful this study will lead to the first FDA disease-modifying intervention, and it will be safe and comfortable for patients to receive. And with your last question, I will absolutely be treating my future patients with this intervention.
Well, a lot of people consider a doctor who makes house calls as the epitome of personal service, but one Oakland doctor may have you rethinking that.
NBC Bay Area's Garvin Thomas is here to show us just what she's doing in tonight's Bay Area Proud. Garvin.
Jessica, Dr. Caroline Hastings is a pediatric hematologist and oncologist at Oakland Children's Hospital. What that means, of course, is she is a very smart woman who deals with some very sick kids. Not all of them, sadly, make it. And that might be one reason to keep her personal distance from them. But that's not what she is about, though. What she is tonight's Bay Area Proud.
Bringing work home from the job, regardless of what you do, is something most of us try to avoid. Even more so when you're a doctor, like Caroline Hastings.
It's a constant struggle for physicians to find what people refer to as a work-life balance, because it is not only just time-consuming, but it consumes us emotionally. And you just can't turn it off when you go home. And here's the drug for the transfer.
What makes Caroline special, though, is that she is a doctor who stopped trying to turn it off. Instead, she invited it in, literally.
I brought my family into my work and my work into my family. It was actually a lot easier for me, and it made more sense, and it was comfortable.
I'm going to take some of this off. I'm so sorry.
You heard her say it makes her a better physician. She says there's a practical benefit. One, she gets to observe these girls outside of the hospital in a home setting, that she can make different observations. The other thing, and is an even bigger story, is the girls suffer a rare genetic disorder called Niemann-Pick C, or NPC. Dr. Hastings, along with the Hempels, are right now pioneering experimental treatment for that disease, really pushing the boundaries of what has been done before, and working with the parents so closely. They have put in a lot of long hours, and they can put in some of those hours under the comfort of home.
Those girls' parents have to be so honored and to have such great care for their children. Oh.
Incredible story. Thank you, Garvin.
If I could make a comment, this isn't a question, but Dee was she was one of those 12 patients that was in the 14-week study. At that time, it was a 9-hour infusion. She tolerated that well. And I have to say that from in the morning when it started till the afternoon when she got off of it, you could see that her skin tone became lively, her eyes became normal, they were bright again, her speech improved, and now she's on the expanded access, a 5-hour infusion. Yay! Party time. But she sees the same results. The skin tone, the speech, and the eyes. So for her at least, from me personally, it makes a huge difference.
Yeah, thank you for that comment. When I mentioned IV infusion, In the regional studies, it was approximately 8.5 hours. For patients that were particularly large, over 100 kilos, it could go to 10 hours. But now the company has done, some changes, and we now are at 5.5 to 6.5 hours for infusion length.
Seeing that I treat patients with blood disease and cancer too, with lots of different types of infusions, I would say Trappsol Cyclo is much easier, far less associated with any kind of infusional reactions. In fact, most people don't have any side effects at all during the infusion. As mentioned, you can be mobile with having an IV in place, and patients usually prepare for their time and bring things to do, and these can be given even in an outpatient infusion center, and timed that works with a patient's and family schedule.